All right, so part 2 of 4, HFrEF versus HFpEF versus HFimpEF, the new EF cutoffs. This is part of the new second universal definition of heart failure in June 29, 2026. It's important that I'll link this down below so you can see exact details. However, the prior system, just to recap, had 4 EF bands: HFrEF at 40% or below, HFmEF at 41 to 49%, and HFpEF at 50% or greater, or heart failure with improved ejection fractions, those with previously reduced EF, now improved EF. So the new system essentially simplifies this into 3 categories that removes the heart failure with moderately reduced ejection fraction. And now the EF cutoff 50%, anything below that is reduced, anything above or equal to 50% is preserved. Anything that was previously reduced and has improved is categorized as HFimpEF. For treatment selection, this essentially previously classified as HFmEF are now grouped in the preserved category rather than reduced. Essentially, the stated basis for this grouping is treatment response data, particularly the SGLT2s, showing consistent efficacy across these 2 combined EF ranges, which is why they essentially simplified it into one. This is distinct from the response pattern seen in the reduced EF, of course. And the stated rationale for removing fixed numeric cutoffs generally is that a single threshold does not account for documented variation in normal EF by sex, age, ethnicity, and imaging modality. Echocardiographic, cardiac MRI, and nuclear-derived EF measurements do not always agree on the same patients, and normal reference ranges differ by sex and age. 2 patients with an identical EF measurement by echocardiogram can therefore represent different clinical populations depending on these factors, which affects both prognosis and expected treatment response. Clinical application of this new update: the patient at 45% EF, previously classified as heart failure with moderately reduced ejection fraction, is now classified as reduced category and management under the same 4-pillar GDMT as before. The improved category remains distinct and trajectory-based rather than value-based. It applies specifically to patients whose EF has risen from a prior reduced measurement, not simply to anyone currently in the preserved or reduced range. Next up, I'll be talking about heart failure staging explained and why stage B is the new priority.